Let's welcome Labour's Shadow Health Secretary, Jonathan Ashworth, to the show. Good morning to you, Jonathan.
Morning.
Good morning. Well, before we go talk about things back home, I'm sure you'd like to give your reaction to that extraordinary blast in Beirut. 100 dead, 4,000 injured from the blast. Still question marks about what the cause was, but obviously lots of calls for international aid, international help for the people of Beirut. What was your first thought when you saw that extraordinary footage?
When I saw it on Twitter last night, I just thought it was absolutely horrific. And obviously, we shouldn't speculate about what caused it, but immediately it was just shocking, wasn't it? And then your immediate thoughts are for the people who will have been affected by it. Obviously, people have died by it, a lot of other people seriously injured by it. Your heart goes out for the people who lived in that area. Absolutely shocking. And your point about aid, well, I mean, we are, as a nation, have always stepped up and provided aid to other countries in need. We've done that throughout our history, and I'm sure that our foreign ministers, our DFID ministers, will be looking at an appropriate response. But yeah, I mean, our heart really does go out to everybody.
Absolutely. Well, of course, the people of Beirut are dealing with that after dealing with the pandemic, the coronavirus, and of course the economic devastation of the lockdown. We're dealing with that right now as well. Your party leader, Keir Starmer, is on the front of the Guardian today talking about how the country or the government needs to fix virus testing, the test, track and trace system, or face a long, bleak winter ahead to possibly face a second wave. What do you think is the number one priority? What the government should be doing right now to actually fix that system?
Well, we've got to use this August, or the government have got to use this August to fix the system. It is critical now. Usually August is a quiet time in politics, as you know, Julie.
I can't remember one of those quiet Augusts for quite a few years now, I'm afraid.
But this is not a time for Boris Johnson to be putting his feet up and watching box sets on Netflix. He's got to be getting this test and trace system fixed. We heard from a bunch of professors yesterday writing in The Lancet, that's the medical journal for the experts, saying that if testing and tracing isn't fixed, we could be facing a devastating second wave by December, and it would call into question whether we can get our children back into school. Now, I agree, children getting back into school this September has to be our absolute national priority. It's the long-term implications of children not being in school is potentially devastating for them and their life chances. So we've got to get children back into school, but we won't be able to do it unless we're doing more mass testing of people, whether you've got symptoms or not, including care home residents and care home staff. The government was supposed to be doing that. Yeah. They've had to delay it. And more tracing of people and giving people the support that if they're asked to isolate, that they actually do isolate and they've got the support to do so. Because there's lots of people in poorer areas, and you see in the figures that the infection rates are going up in poorer areas, and there is a suggestion, or the experts think, that this is because a lot of the time people are asked to isolate who simply cannot afford to do so because of insecure work that they're in.
And this is an issue. Yeah, we raised this with the government minister only yesterday. That lots of people. And I've got a lot of sympathy for those people. I really do. I don't think we can just say, oh well, you're crazy. Why aren't you self-isolating? If you're on a 0 hours contract, you're just paid by the day, paid by the hour. You're not even entitled to sick pay because you're not sick. What on earth are you expected to live on while you're doing what is effectively a good deed for everyone else?
Absolutely, and don't forget, some of these people may not be ill.
Yeah,
because you're asked to isolate because you've been in contact with somebody who is ill. Well, that doesn't necessarily mean that you have got the virus, but you're asked to isolate in case you've got the virus because we need to break the chains of transmission. But there'll be lots of people who will be sat at home, feeling fine, losing wages, thinking about how they're going to pay the bills, how they're going to put food on the table, how they're going to pay the gas and electric bill, and thinking, well, sod this for a game of soldiers. So that's why we need to make sure that people have proper financial support to isolate. Otherwise, you're never going to get on top of this virus when we know so much of it spreads through asymptomatic transmission, people who don't have symptoms passing it on.
And what have you identified as the issue with the test and trace system? Now, Dido Harding, who runs that system, she says that actually they are hitting their targets. Of course, we know this 80% target is not being reached in recent weeks, and we know I think it's 68%. If you fall below a certain level, then it just you're not stopping the exponential growth of that R rate, that reproduction rate, and there are crucial numbers there. What do you think the issue is? Is it that people are not giving giving their details? Is it that it's just a hopeless system? We heard early on, they were calling from a withheld number, the people doing the track and trace. You call from a withheld number, people just think it's someone trying to cold call them, so they don't bother answering. They don't leave phone messages. Even if they did, there's no number for people to call back on. Or do you think that people are not giving their details, they're not answering the phone because they don't want to, for financial reasons or other, to actually have to self-isolate? What do you think the crucial issue is?
Well, at the moment you're being rang up now from an 0300 number. Well, again, I think that's a bit like the withheld number. I mean, I don't know about you, Julie, but if I see an 0300 number come on my phone, I don't answer it. So that's probably part of it. Secondly, it's from a national call centre run by Serco. Well, I just think it'd be much more effective, and some of the statistics show this as it happens, that if you give the information to the local experts on the ground, the local directors of public health and their teams, they can go directly to people in a local area and talk to them about getting a test, talk to them about isolating, and they can usually contact these people. So I think it's now better if the local areas are in the lead on this, and you've actually got some councils like Blackburn and Sandwell and one or two others now just saying, you know what, we're going to set up our own local system because we think that would be a much more effective way of doing this.
Yeah, and I think a lot of people are going to understand that is what people are going to want to do. In terms of this fear of a second wave, now we actually look at the figures. We're looking at 2% of all deaths at the moment across England are from coronavirus. An awful lot of people now are saying, look, why are we locking down our economy? Why are we stopping kids going back to school? Why are we dealing with all these issues when we've got, say, a 40% increase in heart attacks, people not getting cancer treatment? Are we focusing too much on a virus which hasn't turned out, although we've had more deaths than anyone would ever have wanted, and maybe perhaps many deaths more than we should have had, but it hasn't actually turned out to be the mass killer that many had thought it would be? Are we overreacting?
Well, I never like to disagree with you, as you know, Julia, but I mean, I do slightly disagree with you. We've got the highest death rate in Europe, 45,000 people, well, over 45,000 people died. That's an incomprehensible level of deaths, each death leaving behind.
Well, it's not an incomprehensible level. I mean, 1,600 people die every day in this country in a normal average day.
We were too slow into locking down. The government made mistakes early on, which has led to this high death rate. And for people who survive, they also survive now. A proportion of them survive with significant long-term illnesses and conditions as well.
But but the vast majority of people who get coronavirus don't even know they've got it, and the vast majority of people who do have symptoms like me, where they feel a bit rotten. And I was feeling pretty unwell, but nothing extraordinary for a few weeks. That there are just an awful lot of people just saying that maybe we have overreacted. I was in favour of the lockdown. I was in favour of the measures. But maybe we have just directly said we're not going to get a vaccine in the next couple of months. We're going to have to get back to some semblance of normal life. Have we overreacted?
No, I don't think that. I think this virus is deadly. We've got the highest death rate in Europe, and a lot of people who survive. Take the point that maybe not you, Julie, but a lot of people who survive have still got long-term conditions.
A very small percentage of those who've survived.
Yeah, but those people are not able to go back to work. Those people now have.
Well, neither are the people who died of heart attacks, which are up 40% because of the way the health service and the government decided to run our health service during the year.
Well, I agree. I mean, I agree with you on that point. It's not an either or. I mean,
well, it is. No, that's the whole point. It wasn't it? Having a lockdown and turning all our hospitals into sort of mini Nightingale hospitals has meant that people have not been treated for other things. More people, the death toll is very sad and horrific. However, more people will end up dying of cancer and heart attacks than they will of coronavirus.
Yeah, and so one of the challenges for this winter now is to how you reorientate your National Health Service. Because, all right, you're right. The National Health Service, throughout the lockdown, became the National COVID Service in many circumstances, right? And there were people with heart disease who weren't getting treated. Cancer diagnosis was delayed, so there's people who've probably got cancer who didn't get it diagnosed and didn't get the treatment on time. And, of course, the lockdown has probably created long-term mental health problems for many, many people as well. So what you've now got to do, you've got to rebuild your NHS so it can treat those people with heart disease, with stroke, with cancer, and so on, and treat COVID. That's a big logistical operation, but that is the challenge now for the National Health Service. Because at the moment, we're probably going to have waiting lists at 10 million by the end of the year. That is a huge numbers of people waiting for an operation in pain and agony. And we've got to sort that out.
Okay, just finally, also, I know it's not your brief, you're the health brief rather than the education brief, but is it time for the Labour Party to have a serious word with some of the teaching unions and tell them to start trying to work out ways to get our schools back in early September rather than thinking of ways to stop schools coming back?
Well, we want schools to reopen, but to be frank, it's up to the Secretary of State for Education, Gavin Williamson, to sit down with teachers and school governors to hammer this out, because
A lot of these teaching unions are Labour supporting. A lot of them are far left. They're probably not Keir Starmer supporting. They're more Corbynista. But National Education Union and others, they are just putting roadblock in after roadblock after roadblock. Isn't it time that perhaps the Labour Party said that's enough? We need to get schools back.
Well, I mean, if the government think that they cannot resolve the problems facing the nation without the help of the Labour Party, we're more than happy to go in there and take over. The Health Secretary and my friend Kate Green will happily be the Education Secretary to deliver this. I tell you what will be a disaster, though, and this is why this is so important. Right? I don't know if Gavin Williamson is on holiday or not. I don't begrudge him on a holiday, by the way, but it will be a disaster if we get to sort of the end of August, and the government turn around and say, you know what, we've not fixed test and trace, we've not been able to put in the safety measures, schools cannot reopen. I think that would be disastrous. It's why we want the government to take this action now.
All right. Thank you very much indeed, Jonathan Ashworth.